All right, welcome to this week's episode of Weekly Dose with Dr. Uday. We have been talking about children mental health and how to help them in various scenarios. This week's topic is going to be how to pick a therapist for your child or teen. We have Dr. Alugo here, who is our specialist and talking to us through these different topics we've had. So I'm going to start with introductions. My name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a practice, namely Apple Valley Family Medicine, and I also do aesthetics. My goal is to have my patients feeling good and looking good. Now, I start with Dr. Tolu Alugo. She is a child and adolescent psychiatrist. She's the founder of St. John Cap and the Emotions Ambassador Program. She hosts the Walking on Eggshells with Dr. Tolu Podcast. Her goal is to help you balance supporting your child's mental health while caring for your own emotional health. Dr. Tolu, thank you so much for coming on back.
Thank you for having me.
This is so exciting. Thank you. So, this topic again is how to pick a therapist for your teen. So what are the things to consider when picking a therapist for your teen or your child?
So first you want to consider what's the child's diagnosis. What are you trying to treat? Because that's going to determine what therapy is recommended. Because for different mental health conditions, there are different therapies that will be recognized as, like gold standard, first line or second line. Then number two, you want to look at the age of the child. So different therapies are appropriate based on different ages. So like, for example, like depression, anxiety, cognitive behavior therapy will be the first recommended go-to therapy. And you also have interpersonal therapy. If a child is really young, then talking therapy may not work out as well. So play therapy may be what you need. Sometimes it may actually be family therapy. It may actually be the parents that need some help in parenting the child. So it won't be a therapist for the child specifically, but then you can receive support that you can implement, in working with your child. So really understanding what your child's diagnosis or needs are is important. Then you want to look at what is available, because therapists are not always, they're kind of few and far between. Finding somebody who's trained. So for example, if we say, oh yes, you should be doing cognitive behavior therapy. However, what you have in your community is somebody who is trained in interpersonal therapy or art therapy, then that's appropriate. So what's available? Because as long as they have an understanding of your child's needs, as long as the therapy is not contraindicated in that particular disorder, then it will be helpful. Then you want to look at, availability. Okay, I talk about that personality. So sometimes different personalities will gel, some won't. So you might have to try a few before you actually get it right. In this day of virtual therapy, again, what does your child prefer? Will they prefer virtual therapy? Is the therapies that you found available only virtually, or are they far away? Some children don't want virtual therapy, they want face-to-face. So that's also, so preference matters. So those are a few of the things you look at in picking a therapist for your child. I'll let you maybe if you have other questions before I keep going.
Oh, no, I don't. I think I'm just thinking about what you're saying, because that, a lot of times, sometimes you'll have, patients that say, that, I had a session and it didn't go well. And it's, it's probably one of the things that you just mentioned, that they didn't actually, personalities didn't match. And so, what are there any obstacles, like when on the part of the therapist that or at least that is within the control of the parents?
Okay, before I answer that question, your comment about therapy not going well, I always explore that a bit more, because if therapy is too easy, it may not be doing what you should be doing, because sometimes therapy needs to challenge you. So a child may opt out of therapy because it's too difficult. The therapist is asking difficult questions. The therapist is asking you to do things. So you have a child who is socially anxious, and the therapist is saying your homework is to contact a friend. Your homework is to go into the store by yourself and buy a drink or something. And then the child decides, I'm not going to do that, and therefore tells the parents, I don't like my therapist. So in those kind of situations, it may be because the therapist is actually doing what they should be doing and challenging your child. So I'll say to parents, be mindful about moving your child on too quickly, because then you may not just be getting the treatment that you need. So some things on the part of the therapist that may be obstacles. Sometimes they approach the child. Some therapists, for example, I met a teenage girl recently who said her therapist was old looking. She felt she wasn't cool enough, and she just didn't feel she could trust her to give her advice that would be important for life. So I don't know. So how a therapist comes across may be important. A
Yeah.
therapist's ability to really relate with a child of different ages. So some people don't see children because they just feel as if they can't relate with teenagers. A therapist should be upfront enough to tell you, I can't really do this. Um, a therapist may find that a particular case is triggering. So a therapist who, for example, maybe has had an eating disorder, now wants to deal with a child with an eating disorder, they may find that they're bringing their own personal baggage into that therapy situation, and it
Mhm.
may not work as well. Or if they have a child who has had a particular problem that they've dealt with, they're coming at it more like a parent than as a therapist. And sometimes kids can be put off by that. So I think really personality type, being able to come to the child's level, the therapist baggage, therapist being able to, use language that's appropriate, and then availability also is important.
The one about the appearance of the therapist, that's not at fault at all, the way they look at.
I know. This child was just not. This person obviously was firing many therapists, so she was looking for every excuse in the book. So I
Oh,
had to call out on on that.
therapist is just there to try to help you. Oh,
I know. I know.
hard time. Okay. All right. Well, thank you so much for shedding the light on that. So if people are looking to connect with you, how do they find you?
I have a website, www.stjohncap.com, where I have a blog, podcast, Walking on Eggshells with Dr. Tolu, YouTube, Instagram, and Facebook at St. John Cap with a double P.
Thank you so much, Dr. Tolu. This was very enlightening. And for those listening, if you're looking for a primary care physician, we're accepting new patients at Apple Valley Family Medicine. You can find us online at www.applevalleyfamilymed.com. And our phone number is 304-350-1087. You guys have an amazing week. Dr. Tolu, thank you so much. All right, you guys.
Thank
Bye.
you for having me.